Dr. Ryu, thank you for joining us. Today we have the privilege of having Tamisha. She was kind enough to let us video her markings as well as her procedure. And we have the privilege today of having her. She's 39 years old. She's perfectly healthy. She's had 3 pregnancies. The first one was vaginal and the other 2 were C-sections. The second one for breech pregnancy. She's 5'4", 153 pounds. So she has a BMI of 26. And her maximum weight during the second pregnancy was 230 pounds. So since then, she has worked out significantly, has eaten correctly, but has been unable to obtain the body that she had before her childbearing years. So her main complaint is the excess abdominal skin and the looseness of the abdominal wall. So today we're planning on doing a tummy tuck or abdominoplasty, and we're going to correct all those defects. Thanks again for joining us today. Tell us about your defect and what is it about the tummy tuck that you're looking forward to?
Well, I love all 3 of my children. They were a blessing, but they definitely gave me a muffin top. And so I'm looking forward to the flatness that I had before my pregnancies when I used to dance.
Right. So Tamisha was very, very fit before her pregnancies, and she had a very beautiful body. And despite a lot of hard work to get it back to where it was pre-childbearing, she's been unable to because the skin typically is irreversibly stretched out. So there's no other way than surgery to correct it. And that's the main thing about the tummy tuck. We do suction to remove the surface fat. We excise the skin to get rid of the muffin top. And we do a central plication to tighten the muscles that have been loosened up. So Tamisha, if it's okay, let's show the viewers the defect that we're looking at. So if I uncover Tamisha, you can see that she's normal weight, yet she has this extra skin that's very, very distressing to her. And despite working out, this skin does not tighten up. And if you pinch it, it's pretty much less than 2 centimeters, so there's very little surface fat. The main part of her defect is excess skin, and then if you hold your tummy in and then let it go, totally relax, you can see she almost looks like she's 3 months pregnant despite not being overweight. So it's very distressing to most women who have had children because they work hard to try to get their body back to where it was pre-childbearing, and yet they're not able to. So we've already started with our marks. The typical tummy tuck marks are below the C-section scar. And you can see the second and third pregnancy came through here, a C-section. And we're going to make our scar below that. We typically measure 7 centimeters from the anterior fourchette to the lower incision. After that, we mark 5 centimeter intervals as reference marks from the center, which is 0, and then 1, 2, and 3. And then we estimate approximately how much skin we're going to remove, although that's to be determined during the surgery. So the tummy tuck pretty much consists of suctioning the extra surface fat, removing the extra skin, and tightening the central plication for correction of what we call the diastasis recti, or the separation of the muscle. Thank you again for letting us videotape. I really appreciate it. And thank you for watching. Hi, welcome back to Tamisha's Tummy Tuck. We did her pre-operative interview as well as her markings and her intraoperative video. So we have the pleasure of having Tamisha today, 6 weeks post-op, to show her result as well as her description of her recovery. Thank you so much, Tamisha, for doing this. And we're 6 weeks out. You saw from the video the primary concern from her surgery was that she had the muffin top, a lot of extra skin that was hanging over her C-section scar. She had extra fat depositions of her hip roll and the overall abdomen. And even though this is early post-op, you can get a good idea of what it's going to look like. The scars are still a little fresh, but you can see that they're very thin. The topography of the abdomen is perfect. She doesn't have the muffin top anymore. The belly button has a now nice umbilical depression and the medium raphe. You can tell from the butterfly the advancement of the skin was pretty significant. If you look at her pre-op, the butterfly was above her umbilicus or belly button, and now it's well below. So that's a really great demonstration of how low the skin has dropped down. In addition, you can see that the suction really provided excellent resection of the fat. So she has a more hourglass appearance and less of the hip roll. Here's the lateral view in the 3/4. And you can see that Tanisha's not holding in her tummy at all. This whole thing, this tightness, is from that suture, that midline corset suture that we put in. So, Tanisha, you survived.
Yes.
Tell us about your experience.
Well, I can tell you that initially it was nothing like a C-section, and I've had 2 C-sections. It was from us on a scale of 1 to 10, it was every bit of a 9 for the first week or 2.
And that's pretty much what everybody reports. I've never heard in 25 years of practice somebody say that their tummy tuck was easier than a C-section, because we get that quite a lot when they come in for that consult. They think, oh, it's just going to be like a C-section. It's really important to take it seriously and know that the recovery is more intense. So Tanisha has a pretty typical post-op experience. It was worse than the C-section. Tell us about how long you were on narcotics.
I was on narcotics for about a week and a weekend.
Okay.
But I definitely needed the narcotics. They helped with the pain management, especially at night.
And the drain was, we took it out?
In 1 week.
Okay, so the drain's very important. You saw us put it in. It provides both evacuation of the fluid that accumulates, as well as provide negative pressure, so the flap heals nicely to the abdominal wall. And you can see she had basically no post-op complications as far as infections or seroma. That drain is very important to have. So typically it stays in for about 5 to 10 days. How about recovery, enough for work and that sort of thing? How long would you say we should tell patients to wait to go back to work?
Right. I think for me, it's just like a pregnancy, 6 weeks. Well, 2 to 6 weeks. I think for me, it was more 4.
Okay, and that's pretty typical. What I tell patients is it depends on what type of work they do. If it's mainly desk work or supervisory work, they can go as early as 2 weeks, but I usually tell them that's probably a little too early. The intense pain is gone by then, but you still feel like you're dragging a bit, like you've got the flu, and so you're quite tired until a full month has gone by. So for those patients that have a very labor-intensive job, mail carriers, servers, things where you need to use your hands a lot, I think 2 weeks would be premature. I would consider probably more on the lines of 4 to 6 weeks. Do you agree, Tanisha?
Yes,
Yeah.
definitely.
Are there any other points that you think a prospective patient would be interested to know?
Just expect to be curved over for sleeped over for at least 4 weeks, and every week except for the first 2 weeks, do small stretches to help get you back straight.
Exactly. So you saw the amount of skin removed is very significant, and the amount of tightening of the muscle is very significant as well. So particularly the first week, it's excruciatingly painful to straighten out. So what patients do naturally is walk around bent over and sleep in a reclined position. How quickly they straighten out varies. I've had some as early as a week all the way up to 6 weeks. It really depends on the individual, but I would expect a full month before you're normal enough to resume normal activities. As far as exercise, I think it's okay to do light exercise 10 days to 2 weeks later, like walking and stuff like that. But as far as more intense exercise, I would wait, again, 4 to 6 weeks is the magic number.
Yes,
Would you agree?
Yes. I think that after 2 weeks, I was feeling good, and I got out there and
you did it prematurely.
and I needed to probably make a phone call to get home.
Exactly. So that's really important. What Tanisha's saying is listen to your body.
Yes.
I think 2 weeks was probably a little early to do intense exercise. And her body told her so. It said, that's not a good idea. More swollen, more tight. And that's typically what they'll see. They'll see a cycle of flat in the morning and then fuller in the afternoon. And if they do a lot of work, if they have to go back early to work, typically what they'll say is they're okay in the morning, but in the afternoon it's tight and they're sore and they're tired. So that's the kind of thing Tanisha's describing perfectly. 2 weeks is a little bit early for vigorous activity, and that's what your body was telling you. It was saying too early.
Too early.
Yeah.
What helped me with the swelling, because I think that that's a great observation when you're a woman and you're recovering, is the compressions.
Yes, absolutely.
So they help with the swelling, and make sure you just wear them.
Exactly, and that's critical. Even if it's super hot, like we're in the middle of summer now in the South, 90 degrees every day, it's a pain wearing it under your clothing, but it makes a world of difference. I don't think it ends up changing the overall aesthetic result. It would be just as good a year later, but for the short-term recovery, as far as controlling swelling, it's critical. And you can see this is very, very good for 6 weeks. She almost looks like she's 6 months out. And because she's done really well taking care of herself, she's been extremely compliant with wearing the compression. And as a result, she had a much better recovery and a really great early result. Would you add anything else to your post-op explanations? Or would you do it over again?
Yes.
Okay. If you asked Tanisha the first week, I bet you she'd say, hell no, because it's so horrible to recover.
Yes, it is.
But she's far enough out to realize that the changes that have occurred are well worth that pretty horrible 10 days.
Yes.
So you would do it over, and
I
you'd
would.
recommend it to a family member or friend?
I have already.
Okay, good, excellent. Well, it was so nice to have you
Thank you so much.
be involved with this video, because I think it's very helpful for a prospective patient when they actually see from beginning to end what happens on the tummy tuck, and to be honest about what to expect, because that's the key. You don't want to sugarcoat it. You want to be sure that you prepare for it and take it very seriously, because the recovery is tough. So thank you very much for watching the video, and thank you, Tanisha, for being so kind.